Before we begin the next exercise in level 1, the bracket and banding a typodont, we want to take a look at band spacers, which is going to be an appointment that's going to occur anywhere from 2 or 3 days to up to a week prior to your actual banding and bracketing appointment. You need to place band spacers. Band spacers are necessary whenever you're going to band the first molars to open up the contacts enough, one, to make it easier for you to get the bands on the teeth, and two, it's for patient comfort, because you can bring a patient in and force the bands over those teeth through those contacts, but it's uncomfortable. Now, we're going to show you a couple of different band spacers, but in order to do that, we also need to introduce a couple of new instruments. One is the Deluxe separating plier. Now, this is a plier that's used to pick up elastomeric band spacers. And you see those two. There's a purple, and then there is this light blue. The light blue is it's a lighter weight band spacer for a softer contact. Somebody's contacts aren't quite as tight. Then the purple is a heavier gauge, and it's whenever you're really needing a lot of force. And you just pull it off. You pull off the elastomeric off of the stick with that plier, and what it's going to remind you of is a rubber dam forceps. I even used rubber dam forceps in this way to place these sometimes. But you can see that it just stretches the elastic, and then you floss that elastomeric through the contact just like you would a piece of floss. And then you pull the plier out and it delivers that donut. Now that donut's going to shrink, and as it shrinks, it's going to push the teeth apart, and you're going to put one on the mesial and distal contacts through those two contacts, and that's going to, over a time frame of, say, a week prior to your strap up date, your banding and bracketing appointment, it should really open up the contacts nicely. Now, some younger patients, you're gonna find that the contacts are going to open within a couple of days, but you'll have some adults that these need to stay in for a week or even 10 days before the contacts will be open enough to be comfortable. Now, as I said, the light blue ones are just for contacts that aren't quite as tight, and then the purple ones are for the really tight contacts. With the light blue ones, I want to show you a different way to put a spacer in. You can get a couple of pieces of floss and thread them through one of the band spacer donuts, and then you'll pull the donut off of the stick, and then you just use those two pieces of floss as handles. So you just pull that tie, that elastomeric donut, which is all this is, and then whenever you've got it on either end, you've got floss, then you can stretch the donut just like you would with the plier, but this gives you even more control. You can really floss it through that contact. Sometimes it's really the best way, and then you just let go of one end of each piece of floss and pull it through. Another thing you might notice with this particular band spacer elastomeric is that it's got a little ball on either side, and those little balls are very helpful in not losing. Sometimes the patient will chew this right down through the contact, and it'll go down into the embrasure and get into the gum tissue. Those little balls kind of help keep it doing that, and they give you more of a lifesaver, more of a place where you can see it and retrieve it. So that's basically the elastomeric band spacer. Now there is a steel band spacer. In order to use that, I want to show you the Jeroback Plier. A Jeroback Plier is kind of like a bird beak plier, only it's been stretched. It has a square beak and a round beak on the very end, and it's even got some serrations. It's the difference between it and a bird beak is that it's much longer, and I like this plier very much. Use it a lot. Now the spacer itself is pretty tiny. This is a steel band spacer. And let's zoom in on that, see if we can't really come in tight. I know it's small and hard to see, but you can see it's got a little helic, and it's got two legs, and one of the legs has a hook on the end of it, and that leg that has the hook on the end of it goes above the contact, and the little shorter leg goes under the contact. Okay, so you grab the lower leg of the separator with your Jeroback, and then you're going to take the hook leg and place it at the contact, and where you're going to push down and slide that lower leg under and the hook over the contact, and then you just let go, and it's going to snap down around the entire contact. Now that helic is going to squeeze those two legs together and push the teeth apart. Now, whenever the patient comes back and you want to remove this, you will have to come in, of course, from the anterior, and you can just slide into that helic. Now you're going to rotate toward the gingiva and lift the hooked leg up so that it will come through the contact, and then you should be able to pull it right out. The big mistake people make is just grabbing it, trying to pull it straight out, and the hook just sets in the embrasure there, and it won't come through. So you just remember to roll it up and then pull through. And those are the different ways you can place band spacers and get room to place your bands more easily.